Now on to this rough flu season. New numbers from the Cuyahoga County experts show that while the number of new flu hospitalizations dropped significantly last week compared to previous weeks, 6 more people died from the flu, and that's more than half of all the flu deaths the county has seen all season. More than 1,000 people in the county have been hospitalized for the flu this season so far. Now, while this is not a major flu outbreak, hospitals across the country no doubt have been put to the test with an influx of patients. Tonight, at least one infectious disease specialist is sounding the alarm, saying the recent spike in sickness now reveals the system we all rely on may not be well itself. News 5's Mike Brookbank is here with us now, and preparedness is being called into question right now.
Yeah, Rob, while responding to this active flu season has been challenging for those who provide health care, and it always is, there is growing concern about what happens if we see a pandemic or other large-scale disaster.
The hospitals are full. There's flu everywhere.
And right now, experts tell us it's putting a strain on hospitals.
It's a difficult road for them.
Beth Gatlin is the Director of Emergency Preparedness at the Center for Health Affairs in Cleveland.
Preparedness is what if. We need to prepare, we need to plan.
Gatlin's job is to make sure hospitals are ready to respond to any type of turmoil.
Natural disasters, man-made disasters.
Of course, that takes money.
Preparedness funding has actually decreased by about 50% for hospitals over the last 7 or 8 years.
Making it more challenging to respond to a full-scale emergency or a major flu outbreak.
And with that decrease in funding, it's really tight for them to continue to maintain the equipment that they purchased with that funding.
Equipment that could also be hard to get in an emergency.
You can run short very quickly of those critical products and services that are required to provide the patient care.
That's because most of the drugs and medical devices used in the ER come from countries overseas, with no stockpiles here in the U.S.
So we've really set ourselves up for a very, very serious situation.
Dr. Michael Osterholm is the director of the Center for Infectious Disease Research and Policy.
I'm afraid this could be the worst mistake of all here with flu.
Osterholm points to Puerto Rico as a perfect example of what can happen when a natural disaster or health pandemic shuts down production of life-saving products.
With the fall hurricanes we experienced, we're now seeing that very, very major problem because over 60% of all the IV bags we use in medical care around the world are made in Puerto Rico.
Osterholm worries not enough is being done to address shortcomings in the healthcare system, leaving us all at risk.
How many times do we actually go out on the street and try to purchase a fire truck when the 911 call comes in? Of course not. And when it's needed, if we don't have it, we're in big trouble.
And just today, a new report shows 94 of the drugs most commonly used in emergency rooms are in short supply or not available at all. Osterholm tells me in a major flu outbreak or worldwide pandemic, that could spell disaster. Live in the studio tonight, Mike Brookbank, News 5.